historically, where I'm standing is a representation of all types of collections through the decades that Meharry School of Dentistry has been around. I have been privileged to have the opportunity to meet with Dr. Ed Hines, the class of '71, and he's going to kind of walk us through some of the areas that are really interesting, some artifacts, some historical accounts that would really give us some insight so that we can see where we were and have an appreciation for where we're going. So come along with me, sit back, enjoy. Hopefully you learn something new and exciting just like I have today. Thank you. All right. This is it, huh, Dr. Hines?
Yeah, I'm really glad that you're coming by and giving me a chance to show you the dental display. Now, we're very careful not to call it a museum.
Okay.
Because we're hoping and very confident that Meharry will have a museum for the school itself. So this is a display of things that we've gathered over the years, things that we're proud of to show about the dental school specifically. And hopefully one day we'll work together. And as you see, it's a full complement of things, and we can start here. We won't read this, of course, but it's a document from the 50s that was written by Dr. Turner, who was Meharry's president at the time. And he described the dental school and the medical school itself and the contributions that it had made. And we have it so people who are walking back can see that and read that. So it tells a very interesting story.
Wow.
We have pictures and documents. I'm very proud to have collected all the class pictures. It's a lot of work. I went through yearbooks and everything to make sure we had every year. We have some wonderful pictures, and I did my editing and everything. And we were able to get every single year except the late 20s and early 30s.
Wow.
So if one of our alumni happen to have some pictures of like 28, 29, 31, I would appreciate it if they let me know. And then we have every year. So our visitors always like to look for their
Wow.
friends.
Dr. Hines, what would you say was kind of the motivation? How did this start? I mean, you clearly were at the helm of this. What were your thoughts, your motivation?
Well, I have a love affair with Meharry from the first day I got here. So, but Meharry was a place that was in transition during the 60s when I got here. Segregation was ending and all of this. So there was a lot of change. People coming in, new faculty, new people, new attitudes, and a lot of things were being tossed out. And I just instinctively knew that we were going to appreciate the things that were being thrown away. So I started gathering stuff and kept it in my office. I could barely get in my office, but I knew, you see, and I would walk around and I'd see pictures throughout the school, and I would just know that we need to hold on to those pictures.
Wow.
You see. So I ended up quite a few things, and then as people learned that I was interested in this, many people would talk to their parents and things like this. And then I wrote a document to say if you have things that would be good in the Meharry Dental Museum. I'm saying museum, but it's not a museum.
Mm-hmm. Display.
Display. To let us know, and a number of people have donated some wonderful things from the early years. And as we go through the museum, I look forward to showing some of those things.
Okay.
Like some of the cabinets, for example. I put some of the recent yearbooks, and we have all the yearbooks.
Every yearbook.
Every yearbook, and it started in the 40s. You see, we didn't have yearbooks way back then.
Oh, okay.
So I have a little area over there where we have all the yearbooks starting in the 40s.
So prior to that, they just would do photos, and that's how you just had that class
That's how
composite, and that was it.
Yeah.
Okay. Wow.
So this display is about one of our deans, Dean William Allen. He was a graduate of Tougaloo, and he was very influential in my career, and that he was dean when I was here. And I have many things from his office. And as I say, he was a Mississippi person from Yazoo, Mississippi, and he had done a lot of wonderful things. Main thing that he did was he was one of the early African American leaders of the dental school, when the school was still run by non-African Americans. But that's an important historical moment there to understand that Meharry was a gift to African Americans by non-African Americans. And I say I cannot allow myself to be a racist because so much was given to us by Europeans. Meharry, almost all the HBCUs, and when the time came for a change, that change took place with no issue. And so Dean Allen was one of the first African American
to inherit.
Right, to inherit this, to make this work.
This gift, wow.
Dr. Allen had to be very discreet, but at the same time very powerful and very direct. So as students, we kind of really looked up to Dean Allen. He was a very unusual character.
I see OKU here.
Oh, he was one of the original OKU members at Meharry.
Wow.
And I have a document. I'm going to speak to OKU in just a moment.
Okay.
He was one of the original.
Wow, that's amazing.
Of OKU. And these are some pictures that we just gathered. We certainly won't go through all of those, but it speaks to some of the history of Meharry, some of the things about what African Americans were involved with. There's some pictures of old areas of Meharry, the community, and you can see it was really a ghetto for much of that time. But it's hardly that now. It's a wonderful, just like it's a wonderful school, it's a wonderful community. So
now what about this? Now, for me, when I see this, a lot of questions go through my mind because I know that the DDS, the colors are lilac, but this is clearly not lilac. So,
but a lot of us, include me, would use something that was kind of lilac.
Kinda. Oh, wow. Okay.
I think this belonged to Dean Mobley, the first.
Oh, wow.
So I think she may have brought her gown.
Well, and the tassel is clearly lilac. I can see that. Okay.
Yeah.
So it wasn't uncommon to have that royal type purple, deep purple.
But the hardcore Meharrians knew that's not the right color. That's not the right color. But we would do that. And in fact, when I graduated, I wore all black.
Wow.
Yeah. So we have two of those. And this is the older office. And I want to point out some things here. These were some original chairs from the original Meharry in the 1880s, and it was held in storage at the St. Hubbard Church. And they very kindly, the members of that church, very kindly let us have those two chairs. And those are precious to me.
How did you track that down? Like, what was the?
Dr. Walter Owens, who had a position here, belonged to that church, and he knew how passionate I was about getting this, especially once I really got it going.
Oh, okay.
He said, just kind of quietly one day, my church has some of the original chairs. And he might have told me that he had some diamonds to give away. So I jumped on it. And they very kindly, the minister there, whose name escapes me, I wish I
okay.
know, but Dr. Walter Owens helped us get that. Now the paintings here are paintings of a Dr. Taylor, John Taylor. John Taylor was a dentist from Meharry in 1960, I think it was. And he went on to medical school after and became a pathologist. Now he was a single man all of his life, and he liked to travel and collect art. And these beautiful pieces to me are really kind of world-class art. At his death, just a few years ago, he left his work to Meharry. and they were in storage. So of course I heard about that. So I said, you gotta have those pictures, and the school very kindly let me put those here. Now this chair is a very interesting story. These are very high quality chairs from the 30s. Now, the important thing about this, Dr. Clausen, who was one of the non-African American presidents of the college,
Right.
was personal friends with George Eastman from Eastman Kodak. He knew him, and he told him about trying to do something for the free slaves and all that. So Dr. Eastman donated probably 25 or 30 of these top tier chairs, which lasted long enough for me to do my training in these chairs from the 30s to the 60s. I graduated from Meharry in 71, and we were using these chairs.
So these were the types of chairs that you practiced
Yeah, I was
with.
trained on this.
So your patients would sit in these chairs? Wow.
This is a patient chair, it's a dental chair.
Okay.
We used, for the first years of my clinical, we would use these manually operated handpieces, we call them. Some people call them drill, but I cringe every time because it's not a drill. But that's what everybody wants to call it, but it's the handpiece. It's really a grinder.
So how does that? So this is manually operated. What?
Well, this is
How does this work? Okay.
This is the motor, and with your foot pedal, it just starts the motor, and it spins. You don't really have much control over the speed,
Okay.
but you do all of your work. And this chair was in storage, and I personally restored it and painted it. And I was looking at a local eBay type situation, and a person had this unit who basically wanted to give it away. And I recognized it as the perfect part of this. This person was a dentist or anything, and just had it in his garage.
Wow.
And I told him that we're starting a museum of Meharry and all that. And he came from 35, 40 miles away to bring this so we could have it at no charge or anything. So we restored it. And the name escapes me, I can give anything. But so much of Meharry is anonymous, you know, donors. We were very pleased to get that.
So what would you say? I mean, there's an infinite amount of work in here. I mean, we could spend all day looking at some of this. What would you say would be one of the pieces that? What's your favorite piece here?
Okay, well, let's walk around. I did want to bring this.
Oh, okay.
It's not my favorite piece, but Meharry was the first in Tennessee, and one of the first HBCUs to get a honorary Phi Beta Kappa type situation. This is Phi Beta Kappa of dentistry, Omicron Kappa Upsilon, and we were the first, so we still celebrate that every year.
Wow.
So
Wow.
we're very proud of that, so I want you to know that. Okay, now this is actually one of my favorite pieces, primarily because I did it. Let's see if we can get a picture of that. I was actually, if you don't mind me saying it, somewhat of a gifted artist.
Well, clearly.
Yeah. So I made the dentition of a child in occlusion, you know, in correct size and shape and everything. So, and I made an art piece out of it. I'm very proud of it. And I also did one, a tooth in a box. So I'm very proud of that. And I want to draw your attention to some of the pictures too. We have some wonderful pictures from ages ago. And you missed some of my favorites, but this is a picture of Booker T. Washington, who was visiting my hometown in North Carolina. And these are prominent African-American businessmen and professionals. And this is my grandfather, and this is my uncle, his brother. They look totally different because
That's your grandfather.
yeah,
there.
he was the grandson of a wealthy white doctor in a nearby county. And his brother was the African American. So.
Wow.
So we're proud of that. And we have a number of pictures. And so as I say, that's my favorite piece for sure.
I could imagine.
And then you can see that we have a number of items here. I like to draw attention to the articulators. A lot of people think that the jaw determines where the teeth go. But in fact, the teeth determine where the jaws go. If there are no teeth, then the jaw just wrapping around.
Mm-hmm.
So these articulators, going back many years to the 30s and 40s, different categories, they are examples of situations where you can find the exact position where the jaws is supposed to be relative to the teeth. And if you don't have any teeth, you can find that position. So if you have to have teeth created later,
Wow. Okay.
that helps you find. And that's some documentation for a silver amalgam,
Mm-hmm.
which is not used much anymore, but it was a fantastic restoration material. It's silver, copper, mercury, but people have become sort of scared of mercury. But even though it's very stable when it's in dental fillings, and it's an excellent material that served for 100 years, but it's being phased out for quite more aesthetic looking
Okay.
materials.
Yeah, composite resins and things.
Yes.
Okay.
This is a cabinet I want to emphasize some things too. But first, just as a sidebar, I'm a collector of African American kind of memorabilia. So I like those items, so I just put those in the cabinet. But we have some books that were written by faculty members. One, I'd certainly like to draw attention to Elijah Richardson, who was a developer of Meharry's ortho program. He was a graduate of 1958, and he became an extraordinarily prominent person in orthodontics. He wrote the atlas of the facial growth of African American children, and it includes information that can be gathered because of laws now about taking x-rays and this sort of thing. So we'll be referring to Dr. Richardson and his work for as long as there is dentistry. Dr. Butler and others have created some other books. This section is a demonstration of gold work. Meharry used to be famous for its skill in gold work. The students were very well known. And we have an example here that Dr. Ed Cosby of Gainesville, Florida, had done some very brilliant work as a student. And he was from the 40s, and his daughter, Joyce Cosby, from, I'd say, the class of 78, was kind enough to send us some of the work that her father was so proud of. We're proud to have that with our gold display. These demonstrate some examples. We also have some older books that feature dentistry. I would like to point to this old Bible that was given to me by the Bailey Murray family in Rockford, Illinois. Bill Bailey Murray was a graduate of 82, and his grandmother used this book. And
Wow.
he was very kind for the entire Bailey Murray family to see to it that we have that to display.
What about here?
This I want you to see. I'm going to take this out for you. This book, in my understanding, was actually tossed out, and one of the Meharry dental people recognized what it was, and it's actually the early financial records in the dental school, including tuition, I think, and costs, bills, and this sort of thing. This is from the early years. And there were several of them that were taken from, I don't want to say trash, but they were not held as they should. So fortunately, it was Otis Maxwell, as a matter of fact, who was from the class of 60, I think, or 62. I'm sorry, I forget. And he was a historian much like I am, and so he was able to retrieve this book.
So this is like 1909.
Okay, good.
I see 1910. Are those numbers representing the year?
I'm gonna have to assume so. Yes, 1909 September. So
Wow.
that's a very valuable piece of Meharry history. I think it's beautiful.
May I
Please,
flip?
please, we'll be careful. Let's see if we can find some prices of some things. Look at this wonderful handwriting. That did not come out of a computer.
Wow.
Beautiful it is.
So I wonder, are these student names, patient names?
I think these are patients,
Wow.
but I actually did not make it a point to go page by page. I
Okay.
recognized what it was and opened it on a representative page and let that be it.
Wow.
Because it's over 100 years old. So. But it's definitely Meharry. Definitely a beautiful piece of memorabilia.
This is
And the prices here, something for $7 and $10. I think tuition was no more than, it was less than $100 to go to Meharry in the early years.
oh man, I wish.
Really.
A lifetime to pay back now.
Oh, yeah.
But this is probably the oldest text I've ever touched.
Amazing. It's amazing. I think that was pretty low. One of the problems that tends to happen when new people come to a historic place like Meharry, they don't always catch what the history is, or the relevance or the power of the history. So sometimes quite a few things are tossed out to rebuild the room. So much of the things in this display are items that were disposed of or whatever, another.
So, you know, we have one more piece I really wanted to ask you about. And then I have a request of you. But this here, what are we looking at? This mace. So I'm guessing this is a mace. Talk to me. What is this? Just seems phenomenal.
This is a beautiful piece of artwork, actually, that's used in the ceremonial events at the college. Now, for many years, Meharry had a tiny little piece of wood, you know, it was unremarkable. But our own Dr. William Davis, of the class of 83, I think it was, from the dental school, and his friend from the medical school, I think it's Roderick Stevenson is his name. I didn't know him personally, from the class of 84, got together and they said they wanted a nicer mace. So they had this personally made with their own expense, this sort of thing. And I think it's one of the most beautiful things you can imagine. Well, it was dropped at one point and was damaged. So the question is, what do you do with it? Well, the college bought a new one, hardly as nice as this. But Dr. Davis allowed me to get it, to have it repaired, and to put it in the dental display. However, Dr. Davis is very much protective of this mace, so he personally sees to it that during the appropriate ceremonial events, he uses this. And he has been the carrier of the mace, and the leader of the dental school faculty during.
I see that. It says 1995 here. And I think it says he finished in 92.
Is that 92? I think I said 82. Yes.
Okay, so he finished. So he finished in 92, and he started carrying the mace in 95. Wow.
So he's very much. He has the perfect demeanor and look on his face that he's perfect. If ever there were a person who exudes pride in the school and his role, is Dr. Davis. So he's not a question.
And to know that that's gold plated.
Absolutely.
Is amazing.
Yes. He had Dr. Stevenson. What?
Roderick Stevenson. Wow.
Perhaps
Okay.
he'll join us, well, perhaps he's hearing me talk about it now. But the two of them got together and had it made.
Wow.
at their
Wow.
own expense.
That's probably that may be the most expensive thing in here.
Probably so.
Wow, that is amazing.
Handmade.
So Dr. Hines, now I see the level and the quality of this collection.
Yes.
And so my question is, what are some of the rules? Because I'm curious if it would be possible, just maybe,
Oh, yeah.
for me to donate something that could be used in the archive. So, I finished from the class of 2011.
Right.
And this is coming up on our 10-year. Now, I saw a few things in here that are representative of the class of 2011, but I have a piece that I'd like to show you,
I love
and then let's see what you think, okay?
see it.
All right,
That's it. I'll wait right here.
okay. So Dr. Hines, we're the Desert Storm,
Okay.
and that's the class of 2011.
Okay.
Now, once I finished, on my last day here, I put together something. So the reason that flag is tan color is because our scrubs were tan. So what I did was, they would give you about 10 sets of scrubs at the beginning of your freshman year, and you
Right.
just had to make sure that you didn't change in size too much over the course of 4 years.
Right.
Well, so I had an extra set, and what I used with my last set, I took the scrub top, and I had something special done to it. I asked every classmate and every Meharry employee that I could find to put a little
Oh, wow.
well wishes on this. Now,
This is old school Meharry.
I have not seen this since in 10 years.
Yeah.
And we have all types of signatures on here. Dr. Tyus has signed, you've signed, Dr. Henry Young has signed, people who've passed away have signed. Dr.
Ex-Dean, Dr. Sutherland.
Dr. Sutherland has signed. I think Dr. Otis Maxwell signed.
Very prominent faculty member from 1960. I think.
Yeah, and then one of the people who interviewed me for dental school, Dr. Scales.
yeah.
Dr. Scales signed.
Who's ailing right now.
Yes,
We've
but
got our prayers every
exactly.
day for Dr. Scales.
So
Very Scales from Virginia.
if pray tell, would this qualify? Is this enough legacy signatures? Now, there's a few jokes in here because I have some classmates who, they didn't just write their name. I'm known because of something that happened when I was probably in kindergarten. We were asked to explain the first time we experienced some type of racial discrimination, and I told the class that my first experience when we were in Dr. Lavelle's course was a little kid who said, "That guy, you have tiny hair," and I wanted long and tall hair like he had, and but I had tiny hair, so I went home and told my dad, and I said, "I got tiny hair." He said, "Well, son, you do have tiny hair." So a few people have made reference to my tiny-haired experiences on this, but if we were to get it framed, I wonder if there would be a place for this in the museum.
Well, let me tell you how it works. Number
Okay.
one, I do want to congratulate the class of 27. I remember Demetrius Taylor, a military guy, who we have in here too, presented this to me because I was very pleased about it. Dr. Taylor, I think he's still military.
He is. He's now practicing in Texas.
Good.
Yes.
And I think I heard you say that his daughter is a freshman.
His daughter is a first-year student here. Correct.
Meharry tradition. So I tell you the way we like to work it.
Okay.
We ask people not to just bring things and send things, because as you see, there's not enough room. And we have to sort of be selective for room. Some things people are just getting rid of, like old books again. Really. But with delight, I'm going to take this, and I'm actually going to ask you to put it right here.
Oh, man.
I'm going to ask you to put it right here for a permanent spot for the class of 2011. And hopefully everybody will come back and celebrate with Meharry.
Awesome. What?
2000. That's a permanent spot for this, right along with the flag, which we keep over here.
Thank you so much. That's a honor. It's exciting. Achieve my goal.
There you go. There you go. But I do have one other thing I really want to show. That Meharry was famous for the shade.
We have to. We can't end without talking about the shade.
After we do that, we're not going to go back there. We'll let people come to the museum and see because it's dark, and we have all of the yearbooks, all
Right.
available yearbooks, that go back to 1940s. So we gathered all those that were available, which is pretty much all of them. But
So-
we want to show the history of the Meharry dental shade.
So I know a little bit about the shade. We want to walk in. We can walk in and go this way. And so if we look, I know that the Meharry shade was established. It's my understanding that even to this day, there are companies that sell a denture shade that's known as Meharry shade.
Meharry shade.
So tell me a little bit more about it. I see we have a piece here.
Well, before the 40s, all dentures were just pink. You know, the idea was that the gums were pink. But in fact, African Americans have a number of shades of their gums. It's just one of my little quirks, but I think those dark gums are very beautiful, especially on a woman. If her skin is dark and she has the dark gums, it's very much a addition to the beauty of her face.
Is that the physiologic pigmentation? Is
Yes.
that the okay?
Yes, a normal, just as you would have melanin in your skin, you would have melanin in your gums.
Okay.
So Dr. Dean Allen, who at one time was a dean for 20 years, and Dr. Dummett, who was also a dean, both very prominent people in the national. They were national figures. Well, they did a number of experiments and came up with a list of several shades, about 10 different shades.
Wow.
So they're the only people who had done this, and they showed that it was important in the cultural aspect of wearing dentures and false teeth and this sort of thing. So I have the original work from 1940s, which I was very pleased to get. And you can see it goes from the very light to the very dark.
Wow.
So they're considered the Meharry shade. So if you want today, if you want a dark denture made, you say I would like a Meharry shade.
So now, Dr. Hines, you found something for me, and I brought a scan of it. This was the original letter sent on January the 16th, 1947. And it was a letter that was from Cosmos Dental Products. Dr. Allen was the person, like you said, who had been interfacing with this company. And together they were able to, through this company, get that shade out nationally and get it out to the world. And, you know, I think that I've heard a lot of conversations about, you know, what would it take for Meharry to receive royalties for that shade and for, you know, because all over the globe, people use it.
Absolutely.
And, you know, Meharry's name, the Meharry name is out there. However, we don't get, you know, in any type of, right. I did speak, I actually spoke to a few individuals in legal and the patent attorneys for the Meharry Medical College, and I think that what they were recommending was that, you know, if at this point we try to enforce that any company using the term Meharry shade pay us, that they could legally change the name of it. And if they change the name of it, then Meharry's name would no longer be out there. So the thought was perhaps maybe we're marketing better to leave our name.
That's the way I feel about it too.
And that it's putting the word out there that Meharry still developed this.
Right.
And that would always be home base.
Yeah. I actually feel that way too. This was in the 40s, and why dig up something that's so easily tossed away? So I just take great pride in the fact that we had vision to say, let's make teeth represent who we are. And that's what's demonstrated there in the cabinet. And let it be. Just let it be. And I agree with you. Just to have the Meharry name out there is good.
Well, Dr. Hines, I just want to say it's been a pleasure.
Oh, I enjoyed it.
It's
I love it with a passion.
been a wonderful honor to have a chance to do this. I mean, there's so many more artifacts that we did not get a chance to review, but I just want to encourage the listeners to take the time when you're in Nashville to come and to definitely see this wonderful exhibit. I think that they would be amazed. They'd be entertained, get some good laughs in, to see some of the older chairs. You told me that was a dental chair. I didn't know what that was. And so, no, and thank you for your time today.
I absolutely enjoyed it. And I very much hope the graduates and families will come by and let's go through the book, because I definitely have your picture on there.
Awesome. All right. Well, you take care, Dr. Hines.
Thank you very much.
Thank
you very much. Come again.
The Dental Museum is an ongoing labor of love established to chronicle the growth and achievement of this unique and important dental school. When I entered Meharry as a first-year dental student in 1967, I was disappointed to see that there was no museum or permanent display of the history of this internationally respected institution. An institution that for many years had provided nearly a quarter of the African-American dentists practicing in the United States, and dental practitioners throughout the world that were trained to demonstrate a sensitivity to the needs of underserved populations. The items on display come from many sources. Many come from my extensive personal collection, gathered from my 40-year association with the college, as well as from alumni, students, and many contributors and friends of the college. Significant assistance was provided by the archivist of the college, Ms. Christine Douglas. The historical display is not considered complete. I expect that it will never be fully completed, as items of interest pertaining to both the schools past and present will be continuously added. As Meharry Medical College remains a beacon of hope for the underserved populations, so too will the historical dental display at Meharry be a beacon. All of us at the dental school at Meharry hope you enjoy your visit to the historical dental display.